the CBO score is out for the American Health Care Act, and it is not a surprise, but it's definitely a problem. According to the Congressional Budget Office, which is a nonpartisan research group, it is the office that every political party leans on when they want to get the numbers, when they want to get the numbers to either support their policies or they want to look at the numbers to oppose the opposition. So both sides use the CBO. We have to put that in this conversation because as of late, there have been a lot of Republicans who have tried to undermine the validity of the CBO, but all parties involved have used it. So according to the CBO, the healthcare legislation, the American Health Care Act, which was passed earlier this month, would leave 23 million more Americans without insurance coverage within the next decade. I want us to get that number in our head. The legislation that Donald Trump and Paul Ryan and McCarthy and all the rest of them celebrated in the Rose Garden, which was signaling a significant victory for the Republicans, will cause, it is the cause of 23 million more Americans being uninsured, in addition to the 28 million Americans who are currently uninsured, for a total of 51 million Americans over the next decade who will be uninsured as a result of the American healthcare system and as a result of the American Health Care Act. And that's just beginning. According to the report from the CBO, they said, quote, premiums would vary significantly according to health status and types of benefits provided, and less healthy people will face extremely high premiums. Now, we covered this pretty in depth in previous shows. We broke down this so-called victory of the Republican Party and Donald Trump, and we showed you how there are so many waivers that states can get that will allow them to change the types of required coverage, or to change or to give a healthcare system in their state the ability to waive pre-existing conditions so long as they can prove that it's going to bring down the cost. But now we have the numbers, and the numbers are saying that it's going to dramatically or significantly increase the premiums for people who have less than perfect health. On the backs, this is essentially a tax cut. Inside of this legislation is a tax cut, and the tax cut comes at the expense of the sick and the elderly. This legislation will work out good for those who are young and healthy, those who maybe don't even need insurance, right? Your premiums will go down. That is true, but it's going to come at the expense, in addition to your premiums going down and the tax break that the wealthiest Americans get out of this legislation. It comes at the expense of the sickest and the elderly. The new score, according to the Washington Post, the new score reflects a series of last-minute revisions, and we went over those. The two amendments that were added at the end, the amendments were set in order to try to soften the blow for moderates. But even with that $10 billion that was there, that was put in the last second in order to help people with pre-existing conditions survive the increase in the marketplace, it still has put people with pre-existing conditions and the elderly at greater risk because of this legislation. So here's where we are. The new score reflects, it calculates that the American Health Care Act would reduce the federal budget by $119 billion between 2017 and 2026. Now, this is, according to the CBO, this is a smaller reduction than the $150 billion that was estimated in March. So even the AHCA, as it was when it failed back in March, performed better in terms of reducing the deficit, if you're concerned about the deficit in this conversation, which Republicans absolutely pretend to be concerned with. I believe we have a tweet here from Paul Ryan, and he mentions this. He says the US CBO report again confirms that the American Health Care Act will lower premiums and the deficit. And so here we are. It's going to lower premiums if you're young and you're healthy. It's going to lower the deficit, but it's only going to lower the deficit by a smaller amount than the bill prior to this, the one that previously failed. So this bill isn't even performing as good as they're expecting. Now, what does it cost, right? Because we'd like to have the conversation in the reduction of the deficit as though that is the end all to be all, but there's a cost associated with these with this deficit savings. The cost, according to Dylan Matthews of Vox, you have 218 billion. So let's go here. The current HCA costs $218 billion more than the original and covers 1 million more people. And so according to his analysis in Vox, that's going to cost an additional $218,000 per new insured person. So it's not even as efficient. It's not an efficient bill, and it's bringing the deficit down by a smaller amount. And the reason the deficit is able to come down by any amount is because of the cuts in the system, which are going to, in a very draconian fashion, hurt the elderly and the sick. I mean, that's it. I mean, that's the breakdown. There's, like I said at the beginning, there's nothing surprising about this. There's nothing surprising. There's nothing shocking about this. What's shocking about this is that the Republican Party did everything they could to get this legislation passed in the House before the CBO record came out. And they did that because they did not want to be on the record, or they did not want to be held accountable for the reality of what this bill does. And let's be sure, right? I always like to give these, not necessarily caveats, but there's still more to the conversation than just how problematic the Republican version of healthcare is, right? The Republican healthcare bill is going to hurt 51 million Americans. Yeah, but 28 million Americans, even without the healthcare bill from the Republican Party, are going to be without insurance anyway. And so we have a problem in America, and that problem is that we have not realized, like the rest of the industrialized world, the rest of the modern world, we have not realized that healthcare should be a right and something that is structured in a different fashion rather than being built on a profit motive. In other words, single payer Medicare for all. We still haven't realized this in the United States, even though most other countries, developed countries, already have a single payer system of some type. But this is where we are. This is where we are, and now we're in a political fight where we have to try to hold the line, right? And I don't think anyone, I would be surprised if anyone would suggest that this is not worth holding the line, with the full reality, with the full knowledge that holding the line is still not a good place to be. It's better than, like, where we are right now with Obamacare is well, 23 million people better than what the Republican Party wants to do. So this is not to knock Obamacare. We can do better than Obamacare, but clearly we should hold the line here and say, if nothing else, let's not make the situation worse, all for the sake of tax breaks for the Republican Party. For the donors of the Republican Party. That's it. I mean, again, like I said, it's nothing shocking. It's nothing that we didn't expect. But here we are 2 or 3 weeks after they passed that legislation. And now it's our responsibility to make sure that the Republican Party is held accountable for what they're trying to do. I mean, and we'll take this caller in a minute, but this is the last thing I want to say. The Republicans are genuinely shaping out to be the caricature of a television cartoon villain. I mean, the cartoon guy with the long mustache and the twisting the mustache and laughing with a maniacal ha 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 laugh. This is how ridiculous the Republican Party has become. I mean, look at the tweet. Look at the doublespeak in the tweet from Paul Ryan. He can say with a straight face to America that this is going to lower premiums and lower the deficit, when in reality, the lowered premiums are only going to help younger people. The premiums for older people are going to go up. The premiums for people with pre-existing conditions are going to go up. The coverage is going to go down, and there's less coverage across the board, and the deficit is going to go down by a smaller amount in exchange for a tax break. The doublespeak of the Republican Party and people like Paul Ryan is so nefarious that they've almost become a caricature of a cartoon villain. This is where we are in America.